My name is Brigit Carter, and the name of my talk is When I Grow Up. I named my talk that because when I was young, I used to dream about all the things that I would do in my future. But my dreams were often halted by reality, which often snuck in because I knew that my parents didn't have the resources with 6 other children to send me to college. And it wasn't until my early 30s where I really began to live out the life that I dreamed about as a teenager. Education for me was the key to unlocking those dreams, and where it led me opened the door to my true passion. You know, I was designing this program for Leaders for Health Equity, and I tried to think about what motivated me. I reflected over my time, and I realized that it was the willingness of some very key figures in my life who mentored and supported me and helped me as I grew into the professional roles that led and continue to lead me into opportunities that nurture and develop me. And I knew that there were many young people out there dreaming the same dreams that I had in my youth. And reflecting on those times is really what guided me to create this mentorship program to support the future generation of health professionals. But I can tell you the struggle of going from concept to product is very real. And I often laugh when I think about my first organizing statement. I had a clear vision in my mind of what I wanted to create, but how to bring this to reality for me was a barrier. Not only did I need the organizational support, faculty and staff support, but I needed money. I needed the financial support. And I think I pondered over this statement for a week. And then what really became clear to me is that I had to reach out to the head of this organizational chart, which for me was the main stakeholder and the dean of my School of Nursing. And she had to support my vision as well. And what I thought was actually going to be a very difficult task actually ended up being my easiest task. But the most important thing for me out of all of that, it reaffirmed that this was the right organization in terms of core values and missions, and that I wanted to work and immerse myself in this place because what was important to me was also important to them as a School of Nursing and even the broader Duke University. Some of our strategic goals are what supported the funding, and the name of my program is Mentoring to Increase Access to Health Professions. And it's a summer program that I brought 10 young people, young women on campus for 4 weeks, and I immersed them into 4 different clinical fields of the health professions. And really, it was an opportunity for them also to decide what is the health profession that I want to pursue. They were given all the necessary tools. We helped them with resumes. We helped them create personal statements, everything that they would need to prepare a successful application to any health professional school. And then we also assigned a mentor that would connect them over the next year, not only to build their portfolio, but most importantly, to build their confidence, to let them know that they had what it took to be a successful applicant in a health professional school. You know, I reflect often on my summer students' experience, and I often meld those with the experiences that I've had with Leaders for Health Equity. And it just really made me appreciate the opportunities that we've had to enhance and broaden the perspectives of our future generations. Just as I do with them, I believe so do the mentors for Leaders for Health Equity. And today, I think I stand before you with a higher level of understanding of social justice and confident that I have the leadership skills to organize even the most challenging of groups. What I do know, though, is bringing a group of people together who have a shared purpose just doesn't automatically assume that you can achieve the designed objectives. What has made this an extremely effective program is that it is the sincerity of our program leads and mentors, people who are committed to the participants, and as long as the work is being done by the participants, there will be achievement of outcomes. So whenever I bring a group of students together, I really worry about how to connect them with one another. How can I get these young people to work together so the work of the program can be accomplished? This first real moment for me in Leaders for Health Equity actually came during our privilege walk. And while I knew that this walk, I even have my students participate in this walk, I really had a fear of this walk because I was afraid of the unveiling of my own vulnerability, something that as an African American woman, you're not supposed to have. But for some reason that previous week, even though I know it was a short span of time, I felt that I was in a safe space. And it allowed me to share what I thought was some of my best kept secrets. I do remember being exhausted at the end of that day, but I can tell you at the end of those 2 weeks, I felt like that I could trust these new group of comrades with my fears as well as my victories. Over the next few months, we had a lot of online experiences, infusions of readings and speakers. And I tell you, being a lifelong learner, this is something that just excites me and ignites me. And it heightens my understanding of why we need this commitment to achieving health equity. But also what impressed me was the diversity of the fellows and how we were all intrinsically connected through this mission we chose to embark on. And it really became even clearer when we went to Rwanda. As we were graciously allowed to enter the lives and villages of the families, many of us walked away feeling overwhelmed, devastated because of the living conditions, lack of nutrition, lack of resources. And after months of reflection on that experience, what became clear to me were a couple of things. First, coming from a country with an abundance of resources, when we travel to places where things are not in line with what we have available for us, we automatically think that someone is suffering, that living in a mud house with dirt floors or living off the land is somehow subpar, that we had to do something about these living conditions and that we were suffering, they were suffering according to our standards. Now, there were situations where I felt like needed to be addressed by the system or some additional resources, but what I also saw was a beautiful countryside. I saw a husband that took impeccable care of his disabled wife. I saw a mother who had very little resources being able to provide some food and shelter for her children. Just like in the US, we're quick to think about those with less are suffering, when in most cases, those with less just have less, but their lives are just as rich. Coming up, I didn't know I was poor until somebody told me I was poor, one of my classmates. I had food, I had clothes, I had shelter, had a beautiful, loving mother, siblings that I mostly cared about. But this brings me to my second takeaway. We've all been in this situation in one way or another, but we really have to investigate beyond what the eye can see. To me, this clearly shows why understanding social determinants of health is so key. You have to ask those questions and investigate beyond the surface so we can understand the resources and access to resources, or even just how poverty has influenced or limited the access to resources. While our goal is to improve the individual or population health, we also want to empower our future healthcare providers to know how to address the inequities in our system. The first step to that is knowledge. So we need to educate this next generation, and we need to create the interventions to reduce the inequities that they will undoubtedly see in their patient population. And one of the ways that we're doing this, my colleague and I, Carla Ventura, we are creating an elective exploring the human development information through the United Nations Human Development Index. And we're going to have our students compare and contrast some very selected health indicators so that they can also explore what is the role of the nurse while they're reducing these potential disparities. You know, I was very honored to have Carla come to Duke, and I watched her expertise, passion, and engagement as she taught students across the world about human rights and are exploring global patterns of health and illness. And we brought that same passion into designing the course and finalized our syllabus in a short 5 days. While we'll continue to develop these ideas, bringing these two nursing schools together and these two countries together, and helping our students explore dimensions of human development outcomes. I always have to think, how can one advocate for policies if they don't understand where the disparities exist? How can one seek social justice, which I ascertain is the responsibility of the nursing profession, if one does not understand what is necessary to achieve health equity? For me, my journey continues, and all the opportunities, information has been very inspiring. It's been transformational for me, and most of all, I think it just renewed my commitment to health equity. And I've had a lot of opportunities that came about, such as being on the advisory board of Duke Johnson & Johnson Nurse Leadership Program and Duke Health Strategic Diversity Group. These components may not have a clear focus individually, but when you connect them, can produce a strong structure to create and develop and mentor future and current nurses. These nurses will disseminate and advocate for fair and equal delivery of health care through entry-level and advanced nursing practice, through health policy and advocacy, through nursing leadership roles that are positioned and empowered to have a voice in the system. While I may not be able to change the nation in my lifetime, what I vow to do is to put all of my energy into creating this environment where all can develop and thrive, and who are educated on the interventions to create fair, equitable access to health care to improve overall health outcomes for all. Prior to this fellowship, I'm not certain I would have been brave enough to open myself up to all the opportunities that have been afforded to me at this point. My growth is a direct product of those that took the time to reach out, support, mentor, and I in return will continue to mentor and nurture the next generation of advocates for the nursing profession and the populations we serve. Investing in the next generation is the pipeline which will continue to fuel the fight in the reduction of health disparities and equal access and treatment for all. Thank you.